Hello, my name is Joy Ajiboye. I'll be performing the non-parental medication administration. So, I'll perform my hand hygiene. What I'll be doing next is I'll be reading what I have here. So, for the physician orders, Buka Jack, MR 87134651, date of birth 6/20/19XX. The medical record, Buka Jack, MR 87134651, date of birth 6/20/19XX. For the physician, cephalo 500 mg PO Q 8 hours for infection for 8:30. Then the medical, cephalo 500 mg PO Q 8 hours for infection 8:30. Then for the physician, syndrome 100 mcg POQ AM 8:30. Medical, syndrome 100 mcg POQ AM 8:30. Then the nitrobid 2% ointment topical QAM 1 inch on patient chest. For the medical, nitro B 2% ointment topical QAM 1 inch on patient chest. The boat is 8:30 also. So the next thing I'm going to be doing is I'll be preparing the three medication. Which one is on the jar, which this is the jar here, and the next one is my pill and the liquid. I'll be measuring um I'll be measuring the I'll be measuring the amount of liquid I'm going to be using. So there are six rights. The sixth right is the right patient, the right time, the right route, the right dose, the right medication, and the right documentation. So the first thing I'm going to be doing is I'll be checking what I have here, which I've already performed my hand hygiene. I'll take my cephalo. So cephalo 500 mg POQ 8 hours for infection. On my bottle here says 250 mg per 5 milliliter. So I have to calculate how much medication I'm going to use. So this is my cup here, the medication, the cup measurement here. The next thing is the Syndroid 100 mcg POQAM, which here I got it 100 mcg, which when I get to the patient bedside, I'm going to put it that's when I'm going to open it. The next one is for the nitrobid. The nitrobid 2% ointment topical QAM 1 inch on patient chest, which is same thing I got here. So this is the nitrobid measurement that I'm going to be using, which I'll be measuring 1 inch on it. I'll put it on the patient's chest as a pouch. And this is my cup of water here, which I will be using. So the next thing I'm going to be doing is I'll be checking the nursing drugs for the medication for cephalo. For cephalo here, for cephalo 250 to 500 mg q 8 hours. The max is 500 mg q 8 mg q 12 hours, which this is on the high side. So I have to call my physician to know why my patient is on it. So what the next one is the side effect, and also to know if there's any indication why I need to I need to hold this medication, and like to know if there's any indication why I need to hold this medication. So the side effect is dizziness, diarrhea, and also nursing concentration. So the next thing I'm going to be checking is the centroid. So For the centroid, here for the action, increase metabolic rate, controls protein synthesis, which this is for fibroid. And also I want to make sure that what my patient's diagnosis is, if there is if the adult is less than 50, which is yes. So the max dose now is 1.7 mcg per per kilogram per day. And I have checked the weight, and it falls within the normal guidelines. So the side effect now is anxiety, insomnia, tremors, thyroid storm, and also assess the blood pressure. So, and also to make sure that it does not get too high. The next thing I'm going to be doing is I'm going to be checking the nitrobit. For the nitrobit, decrease preload and afterload. So the thread is the thread chronic stable hygiene. And also if there is any sublingual rectal, topical, as well as patch. And for the dose, 1 to 2 inch q 8 hours as needed. So now that I'm done with that, I'm going to be doing my calculation, which is 250 over 500, so 250 mg per 5 ml. And what I got here is 500 for the cephalodon, that is 500 mg. I'll get my book and my paper, my book and my pen. 500 mg over x is equals to 250 mg over 5 ml. When I did my calculation, I got 10 ml, which I have to measure 10 ml on the measuring cup. So if I want to measure it, I have to bend up, pull it down, and bend down to make sure I get the right amount. Okay, so this is the antibiotic here, which is the 10 ml. When I get to the patient bedside, that is when I'm going to administer this. So the next thing I'm going to be doing is I'll be going to the patient room now. Hello, Mr. Smith. My name is Joy Ajiboye. I'm going to be your nurse for today. So I will give you some few medication, which I'll be giving you some few medication. So I will provide privacy and pull the curtain. So, Miss, can you identify your date of birth? Which I'm looking at is a hand band, but it says also right what I have on my record. So today I'll be giving you some few medication. So the medication I'm going to be giving you is cephalo. I'll be giving you cephalo, which is the antibiotic. I'll be giving you Synjoy 100 mcg. Then I'll be giving you the nitrobit by putting a patch on it. So before I give you that, I would like to ask you some questions. I've already performed my hand hygiene, so I would like to ask you some question. Did you just do you have problem in swallowing pill? Oh, you said no. So okay, and also since you don't have problem, I'm going to give you your pill with water, and also I will give you your nitrobit. For the nitrobit, do you have any current pouch? Oh, you say you have on your left hand side. So I'm going to clean that off. I'll clean it with rag and wipe it off and put in a new one at the right hand side, and make sure that there's no hair surrounding it. Also, please make sure you don't rub it or cut it off. Okay, please. So the next thing I'm going to be doing is I'll be doing my last check on the patient bedside. So I'll be checking the three medication. So what I will do is um I will raise I'll be checking the three medication on the patient bedside. So the three medication is this is antibiotic 10 ml, that is cephalo 5 mg POQ 8 hours for infection, nitrobate 2% ointment topical QAM 1 inch on patient chest, which is okay. And this is a measuring, I'll be measuring 1 inch. And also for the uh, Syndrome 100 mcg POQ AM, which this is also 100 mcg. I'll be giving the patient. So before I give the patient, I'll make sure I raise the bed to a comfortable height, and also make sure that my patient is sitting down. So I will start the medication by what um I will start the medication by giving him the um the pill, which is the syndrome 100 mcg. I'll open it, give my patient, make sure he swallows it, and I'll give him with water and make sure he swallows it. And also I'll give him the antibiotic, make sure he swallows it, and also give him little water and make sure he swallows it. So the next, what I'm going to be doing is I'll be taking off the patch on his left hand side. So since I'm taking off the patch from the left hand side, I will put on I will start by putting on gloves on my hands. I've already performed my hand hygiene. So here is my glove. So what I will do is I'll take off the patch on his left hand side, clean it with rag, wipe it, and also um put it on my and take it off out of my um my glove by trashing it and putting on a new glove. So I'm putting on a new glove while I open my nitrobate. I'm measuring 1 inch. I've measured 1 inch. This is the 1 inch. I don't know if you can see it. The nitrobate is on it. I'll be putting it at its right side and make sure there is no air on it, and also putting the label, putting my initials, date and time, which I've done that. So the next thing is I'm going to be I'll take off my glove. I'll take off my glove, trash it, and perform hand hygiene. Also putting putting the bed putting the bed down to a comfortable position. And after putting the bed in a comfortable position. I'll wait for a few minutes for the nitrate to be tolerant, and also ask the patient any question. After asking the patient any question, I'll put a call bell. Um, I'll put a call light at the patient side and tell him I'll be back in the next 30 minutes. So the next thing I'm going to be doing is I'll be performing the sublingual. The sublingual goes under the tongue, and the buccal medication goes between the cheek pocket and inside the mouth. So this medication will be given to a patient without water, and the patient will not chew it. So it has to dissolve itself before I give the patient another medication. Next thing I'm going to be doing is a ice drop. So for the ice drop, there may be a burning sensation. So I will apply clean gloves on my hands. After applying clean gloves on my hands, and have cotton ball or tissue, and I will lower the high link and ask the patient to look at the ceiling and hold the dropper above the above the conjugal sac, and also install the prescribed number of drops, and pressure apply pressure, and ask the patient to close his eyes. The pressure I'm applying is a nasolacrimal, and ask the patient to close his eyes. So the next thing I'm going to be doing is the ointment. So for the ointment, I will apply ointment on the lower lid and ask the patient to close eyes, and apply a clean patch if it's needed. The next one is the ear drop. I will warm the medication in my hands to a room temperature and hold the pinna of the ear. I'll hold the pinna of the ear up, and I'll hold the pinna of the ear up, then and pull the ear back. I'll put the ear back and up. That is for age 3 and up. Then put the ear back and down. That is for age 3 and down. Then I will install the number of drugs and allow it to stay for 5 minutes. Then the next thing I'm going to be doing is a nasal drop. So for the nasal drop, I will instruct the patient to breathe through his nose and hold the dropper. I'm going to hold the dropper above the nose and install the prescribed number of drops. Probably I will install the prescribed number of drops and ask the patient to remain suspend for 5 minutes with the head back. Then the next thing is the enema. So for the enema, if the patient was in a bed, I will raise the bed to a working height and lower the sideway. I will lower the right sideway and keep the left sideway elevated. So I'll keep the left sideway elevated and place the patient in the left side. I'll place the patient in the left side seam with right nail flakes. So then I will apply waterproof padding under the patient, and also I will assess the bedpan. I will assess the bedpan, comot, and toilet before I will begin to prepare for the enema. So if it was commercial, I will verify the order and inspect the container. So I will verify the order and inspect the container for expiration date, and also I will check the hole, or I will check the hole or damage. I will check the hole and expel hair. I will check the hole and I will expel the hair out. So then I will apply clean gloves. I will apply clean gloves. So I'm going to lubricate for 6 to 8 centimeter of the tip to the renal to the rectal tube and assist patient to relax by breathing slowly in and out of the mouth and insert the tip tubing. Then I will separate the bucus and locate the anus. So, and I will insert the tip of the applicator slowly to 6 to 8 centimeter, and also towards the umbilicus, and also hold the applicator in place. So, and then I will administer enema for commercial preparation by what? I will squeeze the tube slowly to expel air out of it, like to expel air, and also remove the tube that is covering, and that I will remove the tube covering with paper towel, and also provide instruction to the patient. So I will retain solution until the patient has the urge to defecate for like 5 to 15 minutes. It all depends on the times. It depends on the time. It varies. So, and the patient's reaction. I will not flush the toilet if the patient expel. So I will provide perennial care if it's needed. So I'll provide glove and perform. I will remove my glove because I already put on my glove. So I'm going to take off my glove and perform hand hygiene. So I will return the bed to the lowest position and raise the side rail up. That is, I'll raise the side rail up and put call light within the reach of the patient, and also I will assess for additional patient needs, because by stating the time, I will state the time the nurse is expected to return, and also dispose any PPE if I'll dispose any PPE, and I will also clean the equipment. If I was in a contact with the patient, I will follow a specific manufacturer, and also I will perform another hand hygiene. So I will document the date, the time, assessment, and also I will and also procedure, um, um, and the patient response to the procedure. Thank you.